Both North and South Dakota have the highest rates of COVID-19 cases and hospitalizations in the nation per 100,000 people. According to New York Times COVID-19 tracker, South Dakota is first in the nation for states where deaths are increasing. In tonight's edition of COVID-19 Beyond the Numbers, KELOLAND's Angela Kennecke compares the beginning of October to the end.
At the beginning of the month, South Dakota had 3,832 active cases of COVID-19. Today, there are nearly 4 times as many active cases at 13,520. On October 1st, 214 people were in the hospital. By the end of the month, that number had almost doubled to 403.
We are asking people to double down on doing what they can to help. Our COVID hospitalizations have risen dramatically.
236 deaths have been reported in the state on October 1st. Now 415 people have died. It's not just physicians and health systems asking people to mask up. Business and community leaders say it's essential to slow the spread and prevent even more deaths.
I am not sure when or why this issue became so dang political. It's quite ridiculous, if you ask me, how political this has become. This is not an R or a D issue. This is a public health issue.
This week, South Dakota Secretary of Health Kim Malsom-Risden was optimistic about a vaccine arriving in the state within weeks.
We expect to see vaccine being allocated by the federal government to the state of South Dakota in the very near future. We've been told to be ready for our first shipment in the middle of November.
But when questioned about what's involved in testing and producing a vaccine and the fact that scientists say it will most likely not be readily available until 2021, Malsom-Risden clarified that the state will be ready to begin vaccination with healthcare workers when they do arrive.
The federal government has asked states to be ready as of November 15th. We will be ready. If the vaccine shows up at our doorstep on that day, it will be it will be getting out to folks immediately.
Doctors say we do have a tool that is just as good as a vaccine should we choose to use it, and that's wearing a mask.
If I told you that I had a vaccine just came on the market today that was 60, 70, or even 90% effective at preventing COVID, you'd be beating down my door to get it.